Hello, my name is Dr. Ahsan Bhatt. I'm an orthopedic consultant with special interest in orthoplasty, sports injuries, and trauma. Today, I'm going to launch a series of videos in which we are going to do examination of the joints of the body, which will be very suitable for people appearing in exams, postgraduate students, and undergraduate students alike. We will go through the scheme of examination of these joints so that it will be made very easy and it will be very easily replicable. So if you're examining in the tests or you're in the clinics and you're doing your own practice, it'll be easy to do those examinations and easy to find the pathologies. So if you have a plan whenever we're doing examination of any joints of the body, it makes things easy and you are less likely to miss important findings. So in my practice, I have a very simple rule that for every joint that I examine, I go through the process of look, feel, move, and special test. And every joint has separate special test, but look, feel, move is going to be the same for any joint of the body, any place in the body. The most important thing that is there for all people to examine is number one, never to forget to introduce yourself, take a proper consent from the patient, and wash your hands. Without it, you should never touch a patient or never start the examination of a patient. And whenever you're seeing any joint, you start with the process of looking at it, you properly expose the joint, you look at it from the front, you look at it from the side, and you look at it from the back. So you just walk around the patient, and that makes it very easy for you, and that makes you look at the thing properly, in detail, and you cannot miss any positive findings. Then you feel, and I suggest that you should have a process of feeling of every joint in the body. For example, if it's a shoulder, you start from the sternoclavicular joint, go to the clavicle, go to AC joint, go to the humeral head, go to the back of the shoulder and the scapula and the muscles. For the knee, so you start with the patella, you go to the joint line, medial joint line, lateral joint line, proximal tibia, distal femur, quadriceps tendon, patellar tendon, and so and forth. So any joint that you examine, if you have a process and you follow it always, you're less likely to miss any important structures or any important findings. After feel, there's move. So every joint has their own certain movements. So you do those movements in the same way for every patient, every time you see any patient. And that makes it much more easier for you to do it for the second time. It gives you good practice for the exams, and also it makes you diagnose the patient more accurately when you do the same thing over and over again. And special tests are different for every joint. So these special tests, in the subsequent videos, we'll be going through the special tests for each and every joint in detail, and we'll discuss them, and we'll discuss when we do it and why these things are positive, why we get the positive findings in those joints. And hopefully these videos will help you to become more comfortable in examination of these orthopedic joints, which can sometimes be quite difficult because less time as undergraduates that we spend in orthopedics. But once you do these examinations frequently, you look at these videos, you'll be very comfortable in the exams or in the clinics in examining these patients. Thank you.